All right, in today's Healthy Living House Call, sponsored by Florida Hospital, we are talking about childbirth, human babies. For expecting moms, there are a lot of decisions to be made before baby arrives. But when talking about a birthing plan, it's very important for expectant moms to be aware of their options and to create a plan that really fits their individual needs. And joining us this morning with more on that is OBGYN, Dr. Mark Crider. Thank you for coming.
Amy.
Great
Appreciate
to see
it.
you.
Thank you.
I always laugh because I've had 3 of them. I always say, you come up with this great plan, and then the day actually comes and everything gets thrown out the window, right? How often does that happen?
Pretty much every time. I mean, you know, we kind of make the joke that the baby doesn't really read your birth plan. Even if you spend all this time trying to figure out how you would like that delivery to turn out, unfortunately, things just change at the last minute, and we have to be prepared for that.
Right. Things happen. Things happen. Okay, so let's talk about first the difference between natural birth and unmedicated birth. What does that mean?
Well, you know, natural birth can mean a lot of different things to different patients. So sometimes it's clear to have that conversation with your physician about what your desires are to make sure that we're all speaking the same language. So a natural birth to many women would, of course, just mean a vaginal delivery as opposed from a C-section. But other women may take that and have other perceptions of they would like to do as least intervention as possible, whether that be about medication for pain or even medications to help move the labor process along.
Okay, when a woman comes to you and says, Doc, I want to have a C-section, what do you say?
Well, obviously there are some clear indications when women should have a C-section as opposed to a vaginal delivery. But when it comes time for an elective C-section, that this is something that they truly would like to have as opposed to a vaginal delivery when it's safe, then we need to have a frank conversation about what the risks and benefits are. This is not a trip to the dentist whenever you go to have a C-section. So there are definitely risks of bleeding, infection, and complications that could really have an impact on future pregencies.
What are ways that women can prevent having a C-section? Because I would say most women don't want to have a C-section. They would prefer to give birth naturally. What do you tell patients about that?
Well, that's something we definitely are looking at on how we can prevent that. One of the key things is reducing inductions. Everybody, I kind of say everybody needs to be patient, and that includes the doctors and the midwives, not just the patient, and that we want to let nature kind of take its course. Let labor come on its own. Let labor, when it is active, progress through the natural stages without trying to intervene as much. That has shown to be helpful in reducing C-sections.
When a woman is induced, does it sometimes cause complications and problems? What goes along with that?
Well, we're not as good as nature, and so that oftentimes requires us to give a lot more medication to start that process. We're taking what would have maybe taken another week or 2 weeks to shrink that down into 2 days, and that unfortunately can lead to some stress on the baby, and just unfortunately we're not as good as nature, and we may not progress to the point that we'd expect that they should be progressing.
Right. You're a good doctor. All right, if you have questions for Dr. Crider, stick around. He's going to answer your questions about childbirth options. If you have something you want to ask him, all you have to do is go to our website, fox35orlando.com/health. We're going to post it right on the front there, and then we're going to check back in with Dr. Crider to see what kind of questions you've been asking.
Certainly.
Thanks, Doc, for being here. We appreciate you coming in. 9:16 right now. Let's check